Okay, another category of drug that works on that whole RAS system, the renin, angiotensin, aldosterone system, is another category called the angiotensin 2 receptor antagonists or blockers, or ARBs. These are newer. They don't stop angiotensin 1 from being converted to angiotensin 2, but they do block the receptors, so they kind of keep the angiotensin 2 receptors from responding to the renin and the angiotensin, and so that keeps the blood vessels dilated. These drugs I call the sartan family because they all end in sartan. And losartan is our prototype drug, or Cozar, C-O-Z-A-A-R. This can be given alone or with a diuretic to inhibit that vasoconstriction. So doctors are going to give these drugs alone or in combination with other drugs to keep that blood pressure down. And they usually go by the accepted guidelines that are mentioned in the beginning of this antihypertensive section, and those guidelines change once in a while. It can be kind of a hit or miss situation trying to find blood pressure meds that work, because everybody's got genetic differences in how these meds are going to work on them and how their body is going to respond. On page 145, we see expected side effects, and the main one we have to remember is orthostatic hypotension, especially older adults. They have an increased risk of dizziness, rapid blood pressure drops that can cause falls risk, increase their falls risk. On page 146, we have some drug interactions, and they tend to be, like I said, pretty drug specific. And so the best thing to do is teach the patient specific information about the new drug that they have according to whatever the healthcare provider gives them. It's important to remember that antihypertensives are not a cure. They help the patient to manage their high blood pressure, but it's very important that they also incorporate lifestyle changes the best they can, decrease their salt, decrease their fat intake somewhat, try to drop a few pounds. Even a few pounds can make a difference to the blood pressure. Lots of fruits and vegetables, not as much processed foods, because processed foods tend to contain a lot of sodium. So as nurses, we just have to make sure that we're continually evaluating the response to the meds and encouraging our patients to take these meds as ordered. And there can be various reasons why a patient is not able to do that.